You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Dr. Tudor Francu, Stellar Success Podcast. All the way from Chicago, Illinois, at 90 degrees Fahrenheit. Dr. Joy, how are you?
I'm wonderful. How are you?
Pretty hot out there, huh?
Yeah. It's really interesting with Chicago Springs and Midwest Springs. We go from, nice temperatures and then we jump up 20 degrees and then we stay here for a while and it's hot and it's humid and it's sunny and here's summer.
Yeah. So, Dr. Joy, what does it mean to be successful in Chicago?
Oh, now that's a great question. It's a loaded question. I think when it comes to being successful, I really think success is universal. And what it really comes down to is patient satisfaction. If we are helping our patients, if we are helping the patients and then the families on top of it. So, for example, I do house calls. In fact, I raced home from a nursing home where I was treating memory care and assisted living residents. And it's not just making sure that the patient is okay and it doesn't have any dental needs, but also letting the families know of my findings, letting the director of nursing know of my findings, letting the nurses know on the floor, the caregivers, the carers on the floor, my findings. It really is a community, and by helping these people and by helping the loved ones through the time of them, for example, my patients that are living with one of the dementias, it really does give them solace to know that they are being taken care of appropriately. So I think success is open communication, good communication, consistent communication, as well as providing care to your patient, but also realizing that it's not just the patient. There's definitely a community behind them.
How did you end up to do what you do right now? Tell us the little story.
Yeah, you want to hear the story? Okay, so my grandmother needed a new lower partial denture, and she had horrible sciatica going down her right leg. And so she was pretty much chair-bound, wheelchair-bound. And at 87, it was all about pain management at that time. There was no more physical therapy or occupational therapy for her. And I get cornered one Thanksgiving. I had just gotten back earlier that year from working in New York. I went to NYU for dental school, and then I did a hospital residency out there. And then I moved back to Chicago, and I was cornered to be told that she was only drinking an Ensure. She was only having a protein drink. And, because she had only one lower tooth left, I had no idea. I had been living in New York for 6 years. So they're like, listen, our dentist will not go to her house. Can you? And the answer, I looked it up, and sure enough, I can practice on Illinois soil. Fantastic. That means I can practice anywhere. So in Illinois. So I went to her house, fortunately, 10 minutes from my practice on my way home, made her a lower partial denture. And as anyone who knows about partial dentures or dentures in general, it's about 5 steps. There's a lot of steps involved. So I know that I had to make it by this one particular Friday because on Sunday she was going to go to church. And there was going to be a senior ladies guild luncheon afterwards. And so as the story goes, my Aunt Mary rolls her in. And when she talked, you only really saw her lower teeth. And they're like, Jeanette, you've got teeth again. And she announced to the entire crowd of 120 women, seniors, elder adults, that I make house calls. This was I love you, Grandma, Merry Christmas, Happy Birthday present. But my aunts and I, we kind of fibbed it. And this is what happens when you fib, or this is what happens when you lie, right? You get cornered, you get caught. And so we had told her that, Grandma, I do this all the time. Don't worry about it. I'll add you to my list, right? Sure enough, I got a phone call the next day. I got forewarned by my Aunt Mary that I was going to get phone calls. She gave my office number out in the city in Chicago to 6 different families. They all called the next day. And the first one that called, it was a grandmother who had been a founding member of this Ladies Guild, but the granddaughter had been volunteering at the luncheon. And they couldn't understand why she had a smell coming from her mouth when she was on a G tube, a gestation tube, and was no longer using her mouth after her stroke 2 years prior. So the hospital, good on the hospital, had told them, look, she's no longer be using her mouth, but keep the mouth clean. So they had been keeping the mouth clean, but now there's this odor and they don't know why. So I figured, well, if I can be a resource of any kind, once again, same parish, 10 minutes from my practice, why not, right? I go over there and the grandmother, I introduce myself, she can blink, and There's a difference between an oral exam and a dental exam. With a dental exam, dentists, dental health professionals, dental hygienists, so on and so forth, we lift up the upper lip. We want to see what's going on in the front, not just the teeth, but we want to see the gum condition as well. I lift up the upper lip and I see a complete denture. The woman has no teeth on top. She's wearing a denture. And the family, I got the entire family surrounded the bed, mind you. She's grandma. She's a matriarch of the family. And they're shocked. They're like, that's impossible. We've been brushing your teeth. I take out the denture. There was a definite odor, not to gross anyone out. Dentistry, it is what it is. The rest of the family leave. I've got the daughter and the granddaughter crying. No, grandma, why didn't you tell us you had a denture, right? I dropped the lower lip. Same thing. This woman is completely edentulous. She has no teeth. And I think what she had done was, I think she took a picture of herself to her dentist at the time and said, make the same. Because they weren't straight across teeth. You know, one tooth was a little askew, one tooth was a little bit longer, it was a darker in color. I think she had them match. And we can do anything with a denture, universally. We can do anything with a denture. So, you know, that's what she did. She never told anyone. She was a widow, so her husband probably took that secret with him to his grave. And here we are with no teeth, and she's got horrible thrush or candida in both her dentures. And I'm trying desperately to remember the prescription for thrush, for candida. And I'm like, this what immediately changed my career trajectory, because I'm like, well, the hospital did its job, right? They didn't have to look in the mouth. They didn't have to intubate. So there was no reason for them to look in the mouth. All right, whatever. But the home healthcare agency, why didn't anyone bother to look in the mouth? And that's what really, you know, got me going on this. And that was in 2008. Unfortunately, it's 2025, and I still see the same problem to this day. There is no, at least in the US, there is no training for oral care. I will say for Illinois, when it comes to those living in nursing homes, there is a requirement that every single nursing home in Illinois, regardless if it's assisted living, so on and so forth, are required to have a dentist to come to the home. But when I talked to the president of our Illinois State Dental Society, great guy, he said, we have no way of enforcing it. So unfortunately, we have several people that have chosen to stay in place in their homes, and also a significant number of older adults that are now living in one of these really good communities. Otherwise, I wouldn't be going there. But there is no precedence, there's no priority on oral care. And I think part of it is because there is no education here, as well as, well, so if there's no education, we don't know what we don't know. If we don't know what to look for, they're not going to do an oral exam. And if they do an oral exam, they're looking straight through. Medically speaking, they're looking at, you know, see if there's tonsils, to look at the tongue, maybe to make sure it's not too pale, to make sure that they're well hydrated, maybe to make sure, you know, ideally, you know, they don't have dry mouth or, you know, xerostomia. But they're not looking to see if there are any teeth, the quality of the teeth, if there are dentures, if the dentures are good. Are they, you know, are they stuck in with adhesive because because one of the clasps has broken off? We don't know what we don't know. And so that's why it's so important to me as a geriatric dental advocate to be, you know, spreading the word, if you will, on the importance of oral care for our older adults who cannot take care of themselves.
Yeah, I mean, obviously, this subject is something that not too many people talk about. It's just a forgotten branch of dentistry, I would say. At the moment people start wearing dentures or have no teeth, they fall out of the system for some reason. And unless you or people like you that like to do house calls and check on them, the family doesn't really do much because, like you said, the education is not there. They don't know what to do. But I would think that, you know, I mean, in principle, it's a pretty basic care that you need to do, right?
Absolutely.
And I'm thinking, okay, even if you don't brush the dentures or the teeth remaining in the mouth, you can at least use some kind of a mouthwash or some kind of hygiene, you know, just, you know, in and out type of thing.
Yeah.
That can decrease the bacterial load. But I wonder if there is any protocol in this nursing homes right now for them to follow up on this.
So when I go
anyone
in, yeah.
take cares of it? I mean, what do they do?
So it's called the ADLs or the activities of daily living, right? And so that falls under meal plans and care plans. And it's supposed to be that when they look in the mouth, they will see, ideally, they'll see what teeth are remaining, so they know what kind of protocol to do for meal plans, for example. Is it going to be regular diet like you and I? Is it going to be mechanical soft? Is it going to be pureed? And then also for the care plan, are they able to brush by themselves without reminders. Do they need gentle reminders? They go into the bathroom. They don't need monitoring. They brush their teeth. Do they need monitoring? Or does a person need to have their teeth brushed for them? I promise you, on a regular basis, none of these steps are being done. What they do call in the U.S., it's part for the federal guidelines for activities of daily living. It is assumed that brushing teeth or oral hygiene is under the term toileting. Go with me on this. So toileting is you're in the toilet, right? And so I've walked into a room where they have their private bath and they're in the bathroom on the toilet brushing their teeth. And the caregiver is saying, well, this is where the person is the most stable because she's sitting down and she can brush her teeth and I can be, changing, whatever that needs to be changed and we can wash her face and we can do everything while she's on the toilet because she takes her time. I can't clean their teeth in the bathroom. That's completely against federal guidelines, but they can do this. Okay. As long as it's being done. So the idea is everyone is brushing their teeth, once again, ideally, before they go to breakfast. So they're getting out of bed, they're being changed, hands and face are washed, they're brushing their teeth, they go to the bathroom, and they go to breakfast. And that is it. There is no brushing the teeth after breakfast, lunch, dinner. So they're supposed to have their teeth brushed before dinner, but ratios across the board for patient or resident to caregiver or carer is very bad, right? And so the idea for the evening shift carers is that everyone has to get to bed, right? And brushing teeth is not considered a priority. And so therefore, if I'm not writing physician's orders to make sure that they are being brushed, they're not being brushed, or their dentures are not being taken out. Or their dentures are being taken out, but they're not communicating to the morning shift where those dentures are if they're not always in the same place. And that's how dentures get lost. Directly before this podcast, I had an email correspondence with the director of nursing in one of my homes where the upper and lower set of dentures were lost because there was a new carer who had came on board and didn't know this person had dentures and cleaned, spick and span, cleaned the bathroom beautifully, but wound up throwing out the dentures at the same time, not knowing that those were hers and that they were supposed to be worn. So now I have to go in and make new dentures.
Is geriatric dentistry a specialty in your branch?
No, not in the U.S. It has been brought to the American Dental Association 4 times.
I see. So who is doing this subspecialty basically?
Exactly. It's a great question. And it's general dentists. And there are certain states where dental hygienists are able to, they're not doctors, but dental hygienists are able to go into the homes unsupervised, where they have a doctor, quote unquote, overseeing everything. And that's where teledentistry has gotten to be really popular. And this is across the board too, universally, where the hygienists are going in. If they can take x-rays, they'll take x-rays. And then everything is emailed to the doctor, the dentist, to review. And if there's any findings, then the doctor will come in, they'll have their book of patients, and then they'll see those patients after they've been cleaned. That is fantastic. Unfortunately, it's state by state, and not every state does that. So it's unfortunate. So in Illinois, hygienists are not allowed to practice unsupervised. And if they don't take a certain amount of courses, they're not allowed to practice supervised, meaning I would be in the home and then I could be, treating a patient, let's say making a denture or whatever, doing, dental stuff, and the hygienist could be going in and cleaning their teeth. It really is a state-by-state basis.
What I'm trying to get at is the fact that it's underserved. It's an underserved specialty. And not only that, but the amount of assisted living facilities that are popping out everywhere, basically.
Everywhere.
How do you serve those? How do you meet the demand of so many people needing dental care, assuming they don't have a family to take care of them?
Oh, yeah, absolutely. So fortunately, I know of 3 other people in the Chicagoland area that also perform the services that I do and do it well. So there's
how
2
much
different.
Can you cover?
So I do it 3 days a week. I go to 18 homes. I go to 1 home a month. And I treat as many patients. So sometimes I'm seeing 2 patients. Like today I saw 5 in an afternoon, today being Wednesday. So, tomorrow I'm going to 2 different homes. Friday I'm going to 2 different homes. I see them between breakfast and lunch. I travel during lunchtime. I'm eating in the car. And then I go from 1 o'clock to 5 o'clock whenever they're going to be going to dinner. And this is what I do.
Okay. So and exactly how can you help them when you go and see the patient? What kind of procedures do you do? What can you do to help them?
Yeah, great question. So cleanings, exams, I can re-cement caps or crowns back on. If a crown is lost, I can take a new impression. and have a new crown made. Anything you can possibly think of with a denture. So unfortunately, the denture will have to be taken from the patient, in order for my lab to fix it, because you can't do that chairside or bedside. But yes, so adding a tooth, replacing a tooth that had fallen out, anything you could possibly think of. It's fractured. We have the means now to fix them. And regardless if there's a guardian, like a legal guardian or family, they're very happy to hear that they're not going to have to spend X amount of dollars to make a new denture. If it's broken, for a tenth of the price, we can fix that denture, and it's one visit, and I can send it back to them. And I also do extractions. So if someone is on blood thinners, I need to get the prescribing physician, not the NP, not the physician's assistant, but the prescribing physician, the doctor, to sign off on protocols if they're on Eliquis or heparin or warfarin, whichever one they're on, to know how many days it needs to be DC'd before I can go ahead and extract that tooth, and then when they can be put back on said medication. But you name it, I do it. There's
You
also
do
a
it on
wonderful
site.
Yeah, I do it in their rooms.
Okay. Do you have an
Absolutely.
office of yourself where you go back to?
I do have a practice. Yeah. So I have a sterilization bag in the car. So I take my instruments. I have a biohazard bag that I throw all my instruments in, and then I put them in the sterilization bag with it. It's got an antiseptic lining that I change out every time that I go someplace. So once a day, pretty much. And then they get sterilized at my office in the city, on the north side of the city, on the north side of Chicago. So
This
yeah.
reminds
So
me of the, some old movies. Remember when those traveling dentists were
yeah,
traveling in their
with a
little
black
buggy
bag.
cars and,
Yes.
going from house to house in the rural areas. And, that's, that was very effective. And I think the
Yeah.
model for that kind of demographic patients, it's very effective because they
love it.
cannot come to you in your
No.
office. And I don't know, how do you make dentists to do what you do?
I can't make anyone do anything.
No, I mean, how do you market
But
yourself?
I don't need to anymore. I mean, it is unbelievable. I mean, I get, for example, yesterday, the first 5 phone calls, because I was sitting in my office, my first patient didn't show, which is fine. They were sick, but I can hear the phone ring, and my office manager answered the phones. The first 5 phone calls yesterday morning were nursing home patients, families that were looking for me to provide services. Word gets out, and it started with a person who, for the nursing homes, it started with a colleague of mine. We were in a networking group together. I was trying to network my private office, not necessarily nursing homes. She said, "Would you come see my mom?" Absolutely. I had to be vetted, right? They had to make sure that my license and my malpractice insurance and my, drug and all that stuff was, up to snuff. And then I started seeing the patients there. And then, we're all tight communities, right? And so, they have their own Facebook groups or whatever. Like, hey, do you know someone who can come see? And then we're just, so I actually added my 19th home on last Friday, that I'm going to be going to. And, it is what it is. Emergencies, I'll see same day, like after work. Mondays and Tuesdays, I go into my own office and practice on my brick and mortar patients. And then Wednesdays, Thursdays, and Fridays. And if there's an emergency on Saturday or Sunday, guess what? If it's not a patient no record, I'm there. And that's, my call of duty, so to speak. But having other people do what I do, it really has to come from, like, for me, it started with my grandmother. A lot of the dentists that do this, they've had similar situations as well, where it's been a loved one or patient, or like, hey, you know what, you're 2 doors down from where I live. True story. That's one of the dentists. Can you just come over and see my grandma? And then they develop a book of patients because they realize this is so necessary, number one. And number two, it is possible. You sometimes say, oh, well, a lot of times you have to think outside the box. I had one patient that I saw today. He got into bed. Fantastic. He propped his head up. It was just like a dental chair when you lean them back. Perfect. There was a chair that I rolled in. There was no arms. I just rolled in, sat like I would in a dental chair, cleaned his teeth. It was perfect. He was happy. I was happy. We do it.
Yeah, it's obviously this comes from passion.
Yeah,
you can't do this thing without being passionate about patient care, because it takes an effort, first of all, from you to go and see those patients at their site, and then it's not an easy job to deal with an older geriatric population.
I find it easier. I find it easier to work with the geriatric population than the children, quite honestly.
Oh, well, I'm not comparing with the children. I'm sorry.
That's okay. Don't worry about it. Yeah, it's all good. Depends on the person, like anybody else. I mean, you can have a problem patient in your dental office as well. I mean, so what it comes down to is, meeting them where they are. Yeah. So, I became a certified dementia practitioner, and that helped me a lot. It really comes down to, not just making sure we make eye contact, but to make sure I'm at their level, regardless of what their diagnosis is. No matter what their mental health status is, we are still equals. They still consider themselves adults. So I am meeting them where they are, and I only go as far as I can. I will say there was one time with someone with Louis with pretty significant, probably mid-stage Lewy bodies dementia, where I had to have two carers help me finger remove a loose bridge and a loose tooth in the front. They had no idea these teeth were loose. These were, oh my gosh, total choking hazards. And it was pulling teeth would have been easier in a dental office than what I had to do for her. But I mean, I was able to take them out with my fingers as if they were baby teeth.
Yeah.
And it was rough, but we did it. But we also have some
So
brevity too.
yeah, it's very interesting to me that, people like you are out there. I I can't thank you enough because I had older parents too, and my mom had dementia, and she was a dentist.
Oh, wow.
And she became, you know, in a stage, like you say, that she didn't know, what was going on. And fortunately, there was a person like yourself that took care of her from the dental point of view, and she was very happy. So, and I, as a family member, as her son, I could not thank enough uh, to that person that did that. And I can imagine families would be, they're so happy to have you taking care of that aspect because it's a thing that nobody wants to do.
Oh, seriously. But what's
Um,
also very interesting is that I've also, back to the success part of it, is that because of this part of my practice has grown exponentially, number one. Number two, I also see that because they see how I treat their loved ones and they know it's difficult. A lot of them are not in denial. They know exactly how tough this is. They know exactly what's going on with their family member, their loved one, that they become patients themselves. So I have seen sons, daughters, grandchildren. I've seen nurses. I've seen carers that have come to my practice. So that part of my practice is growing. And I'll warn them. I'm like, you might not see me. You might be seeing my fantastic associate who I adore. She's amazing. But I'll be because I'll be at probably the home, that your loved one is in, and
yeah,
they're perfectly fine with that. But they see, the kind of service that my office provides, and they want that same service themselves.
yeah.
And that's
That's
what
that's not.
generates
There's
success,
no better marketing than that.
right? And then just
Um,
being yourself, do unto others.
right. So, Joy, let me ask you. You're obviously very successful in what you're doing right now, and your personality and your dedication shows up every day. You probably had a time where things didn't go well, and you struggled, and you had maybe some failures from which you learned to become this successful. What are some examples of that?
Oh, so at the very beginning, I had not become a certified dementia practitioner yet. And I had a family ask me to make a set of dentures because the loved one had lost hers. And she was in mid-stage Alzheimer's. So she was very amenable for me to take the impressions and do all the things that I needed to do. I asked her to open her mouth. She would open her mouth. She was no longer verbal. Bottom line, she refused to wear the dentures. And she had been without dentures for so long. The nursing home, to their discredit, had not told the family when the dentures were lost. So they didn't find out, they think maybe even up to a month later. And then it takes a good month because I have to wait for the lab and it's about a week in between to make. So this woman has been without teeth on a puree diet, perfectly healthy. Fortunately, there was no failure to thrive, but on the puree diet. And guess what? She was happy as a clam, right? And that was a failure. I had to return the money because they weren't wearing, not all of it. I think I returned half because I did have to do the work. But this is when I should have said, she's happy. She's smiling. She's eating. There's no change of weight. I think, yes, it is very difficult to look at your mom without teeth. Yes, it has aged her quite considerably. But in this situation, we have to put the patient first. We have to put my patient, your loved one first, and let it go.
Yeah,
And that is one of the hardest conversations I've ever had to have because, of course, the daughter's got tears in her eyes. She's like, well, my children won't go see her now because she's without her teeth. And I'm like, you know what? That's horrible. And I'm so sorry that that is the case. But at the same time, your mom's happy and
yeah,
she's eating and she's with her friends. She
yeah.
sits at the
It was
same table
obviously
every
the right
day.
decision.
It was, yeah, but you know what? I mean, I spent all that time making the dentures, and let me tell you, they were beautiful. I mean, they fit her perfectly, because you always worry about that too, right? They were perfect. But so that was a fail. That definitely was a
Yeah,
fail. Or I had a situation just recently, and shame on me on this because I've been doing this, like I said, since 2008. I had a patient who was pretty much in end stage Alzheimer's. The patient had been hospitalized. Hospital had lost the dentures, and the daughter begged me to make another set for him. And I'm thinking to myself, my first gut intuition was he's not going to be around long enough for me to make these dentures. But I acquiesced. I, was in the process of making him a set. He was failing to thrive. He wasn't eating. He was losing weight, so on and so forth. Should have been in hospice. Family denied it. And he wound up passing prior to me finishing the dentures. Once again, I had to return, the money because the dentures were never completely made. So up to a certain point, I, gave him pretty much 2/3 of what, how far I had gotten of their monies. And
Yeah.
once again, I should have stood my ground, gone with my gut, and said, I don't think this is appropriate for your dad. So that's another problem.
Let me veer into a different aspect of your job, the financial aspect.
Mm.
How do you manage to be successful financially into this kind of subspecialty?
So, yeah, what it comes down to is the majority of the patients do not have any type of insurance at this stage of the game. So it is fee for service. And we use fee for service prices, and the American Dental Association has gotten it down to a science where it's based on zip code. So depending on where they are, that's where I base the numbers on. And it's code by code. I mean, it's they've got it down. And so if there is a complaint, I can show them this, which I have done historically, and been like, well, this is what I'm supposed to be charging based on what, this foundation says. And then we always get a credit card on account because I have been burned before where, oh yeah, we'll send a check, and the check never came. And it's disappointing. And they obviously they didn't respect my work. What I've also noticed is that I don't charge, a lot. But at the same time, I found out that when I started using the fee for service prices, which elevated from what I originally started, there was more value in what I did. And therefore I was being paid appropriately, which blew my mind. I couldn't believe it that, at a certain point, they were like, no, absolutely. Of course we'll pay that. Not a problem. And then if they do just, so if they do need a deeper cleaning and they can handle it, or, if I try to repair their denture and let's say it doesn't work and now I have to make them a new denture, there is once again that open communication, expectations have been set. I give them fair warning. And the great thing about dentistry is that we can have multiple plans. Plan A is, we could do nothing. If there's no abscess, if there's no infection, if there's no loose tooth, if there's no pain. And for example, today I saw a patient with a chipped tooth. If the patient was in my office, I probably would have capped it. He's in no pain. It happened a week before. I leave it alone. So financially, we always have a credit card on account. I let my office manager know, how much to charge for that person. The credit card is in charged after I've seen them, and then they get a receipt, and sometimes they need an invoice depending if it's a legal guardian. If it's a legal guardian, we have to send an invoice, and then we get a check from them, but they are legally obligated to pay me. And so I've never been burned by them. So that's what it really comes down to.
Because I think the insurance model is completely out of the question for what you're doing.
And we will, if they happen to be a union, for example, so if they were in a teachers union and they will have dental insurance, like my own father will have dental insurance until he passes, we will submit the claim. We take care of all that for them, but we expect payment up front. And like I said, my office manager is really good at triage. She explains everything to them. She explains them exactly that. She takes all the insurance information down, and then they get directly reimbursed by said dental insurance company so that they get their money, their money is based on what the dental insurance wants to pay, but I've collected my fee for service money.
I don't even know who has dental insurance nowadays anymore. That's a whole different discussion. But
which I would love to go through. It's fascinating. It's a great history, but yeah, it's unfortunate.
Yeah, I have so many things to say on that. But
I'm sure. So do I actually.
It's like dental and pet insurance. They're both two things that I rarely open my mouth about. So Joy, with your wisdom, after all this happened to you and all the career that you have, if you would look back to yourself when you were younger, what kind of advice would you give to yourself?
That is such a great question. Wow. In my senior year of dental school, my D4 year, I really thought I was going to stay in New York. I thought I was a true Manhattan. I never in a million years did I think I was going to be doing this. I thought I was going to be doing all aesthetics, like all veneers and all that stuff. I think what I would tell myself now is to be patient. It will come. Be yourself. Continue to be yourself. And once again, it's not just the patient that you're treating. I didn't realize until I had the first director of nursing in one of my first homes ask to be a patient of mine if I was accepting new patients in my office, that I was really making an impact, not just for the patient and their families, but everyone that surrounded me in the community. And that was a true eye opener. To be kind, not to put anyone down. They don't know what they don't know. It's because they're not educated. They're not required to be educated in this. So now I will be part educator as well, and they respect me for that. And once again, I've gotten patients because of that. So yeah, be patient. It will come. Continue to be kind because you don't know who you touch. Yeah, to realize that it's not just the patient, but everyone else in between that you work with too.
That's so beautifully said.
Thank you.
How can people reach out to you if they need
Absolutely. I would love
any
that. Please
details?
consider me a resource. Absolutely. And pictures speak 1,000 words. Blot out the eyes and I can take a look. Yeah. So my initials are J, V as in Victor, P as in Paul. So JVP Dent, kind of makes sense. JVP Dent at Gmail. I am open and I would be more than happy to provide any kind of help that I can for those in need. It's what I do.
I appreciate you being here, and I wish you much more success in
Thank
what
you.
you're doing. And I think you have to some kind of infect, I would say, other people in your profession to do this same thing, because I think it's totally underserved. I think you guys need so many more clones of yourself, so to speak,
Been told that. Yeah,
to take
absolutely.
care of this aging population right now. And you're doing a great job. I congratulate you for that, and good luck.
Thank you. Thank you so much. It's been such a pleasure to be here. You asked great questions. I think this was a fantastic conversation. So feel free to have me
Thank
back
you so much.
anytime.
Thank you.
I really enjoyed this. Thank you.
I appreciate it. Thank you. Bye-bye.
Bye.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, leveling up for medical pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.